My name is Rejeski from the LMU University Hospital in Munich, and I had the pleasure on speaking about immune effector cell-associated hematotoxicity, or Icaht, after CAR T-cell therapy. And so we did a multi-center retrospective analysis of about 550 patients across three sort of retrospective cohorts spanning 5 CAR products, and we studied the incidence rates and the severity of prolonged cytopenias, meaning low blood counts after CAR T-cell therapy. And so in this study, we were able to show that the distribution of severity grades using this new grading system differs between disease entities and according to the CAR product. So we saw that there's a little bit more of prolonged cytopenias with the patients receiving brexacaptogen autoleucel for relapsed refractory mantle cell lymphoma compared to both LBCL but also multiple myeloma. And we performed specific analyses to try to understand the risk factors better. We found that patients that had a lot of inflammation prior to therapy, they were at risk. Patients that had low blood counts already prior to therapy were at a higher risk. And this is something I think that's a really relevant side effect of CAR T-cell therapy, because we observed that the patients that have these cytopenias, these low blood counts, they also have a higher incidence rate of infections and deaths related to non-progression related events, which we call non-relapse mortality. And so finally, we showed that this grading system that was developed together with the European Hematology Association, or EHA, and the European Bone Marrow Transplantation Society, or EBMT, this grading system that we developed, it's really clinically relevant in terms of identifying patients that are at really high risk for the consequences of very severe hematotoxicity after CAR T-cell therapy. And so I think what this is giving us sort of an expected framework as to how often we observe this side effect across different CAR products, across different disease entities. That's the one. And I think this is really the basis to now compare this toxicity, hematotoxicity, in a really standardized and harmonized manner. And hopefully we can now develop the same type of sort of severity-based recommendations for this toxicity as what we currently have for CRS and ICANS.